As a ball and socket joint, the normal hip is capable of a wide range of motion. A rounded ball of bone at one end of the thigh bone, or femur, moves or articulates inside a cup-like socket that is part of the pelvis. Articular cartilage, which is smooth and firm, lines the socket and covers the ball. Normal cartilage allows the ball to articulate or glide smoothly within the socket to give you full motion of the hip and movement without pain. Arthritis is a condition where the cartilage lining the hip joint wears out. The joint no longer moves smoothly without pain and discomfort. Mobility is usually affected as well. Patients with arthritis of the hip experience pain, particularly with activities such as walking, stair climbing, arising from the seated position, and prolonged standing. They also have difficulty with athletic activities involving quick changes in direction, and moving beyond a limited range of motion causes pain. The most common form of arthritis of the hip is degenerative or osteoarthritis. Trauma to the hip joint, such as fracture of the ball or socket, rheumatoid disease, or other types of systemic arthritis, can lead to breakdown of the articular cartilage and degeneration of the hip joint. A sensation of grinding and popping can occur in the hip joint when the articular cartilage is worn, either partly or completely. One bone rubbing directly against the other produces pain. The first X-ray shows the normal ball and socket of the hip joint. There is a wide space between the ball and the socket, which is occupied by articular cartilage. This is a normal joint space. In the second X-ray, the ball is rubbing directly against bone. The space for the articular cartilage has been eliminated, and the bones are in direct contact with each other because the articular cartilage is completely worn away.